So, hello everybody. Myself, Dr. Shobhoshachi Das, child specialist. Today, my topic of discussion is another common childhood problem, which is head injury in children. Before going into the topic, I would like to invite you all to join my group in the YouTube. I have created a membership community where you can join and discuss problems among yourself. In each of the problem, I will be joining, trying to guide the discussion with latest scientific guidelines and scientific rationally, and also we'll try to discuss regarding prevention of certain problems so that you do not have to face the problem. We can prevent the child from going into the problem. So please join into my group. It is in the YouTube page, and you can join here. Now, going into the topic of head injury, I find in my practice that it is something of very common, and it is something very distressing for the parents. And I have seen head injury in children right from birth till adult age. So it is very common because it is very easy for a child to bang his head. Like in the first 6 months of life, the child may fall off from the bed. In toddler age group, while the child is starting to walk, he may fall while walking or hit himself with any furniture or like that while walking. And in older children, during certain playful activities, certain sports, he or she may bang on his head. So first, I would like to touch upon the preventive aspects of head injury. So it is a very common practice in our Indian culture to make the baby sleep on the same bed as of the parents. So, but I would like to recommend to buy a cot, a small cot with railings, and keep the baby inside the cot, and keep the cot just beside your bed. By that, there is no chance of of the baby falling, and also you will be able to monitor the child from your bed because the child is just beside your bed. And it may happen that in deep sleep you may hurt himself by your hand or any or your leg or anything. So keeping the baby inside a cot and keeping the cot just beside your bed is a very good strategy in preventing any injury to the small babies. So after 6 months, when the baby starts rolling, like in 7 months, 8 months, and then by 9, 10 months, when the baby starts crawling, there's an increased chance that the baby may crawl out of the bed or roll from the bed and fall on the ground and hit his or her head. So you have to be cautious when the baby starts rolling or when the baby is crawling. The baby should always be under supervision of some adult. Now, once the baby starts walking, there is increased chance that the baby may hit himself or herself while walking. And if there is certain furniture or there is a sharp edge of a wall which the baby can hit, the sharp edges are very notorious for causing internal injuries as well as external injuries. So if there are any sharp edges inside your houses, like any sharp edge of the wall or any sharp edge of the furniture like this, there is a sharp edge. So if the baby hits on this sharp edge, there is increased chance of injury. So what we can do, we can cover the sharp edge with some padding, so that if the baby falls on the sharp edge, there is less injury. So try to pad all the sharp edges inside your home when when the baby is toddler and he's walking around inside the home, and there is a very high chance that the baby may hit with on this sharp edge. Now, next is the bit older age group when the child starts joining activities like cycling, skating, or skateboarding, anything. So always wear these safety equipments which are available, like a helmet or anything when because he is just starting to learn, and it is very common to face an accident while in the earlier stages of learning. So using a helmet during certain sporting activities is always recommended, be it a food, be it a your cricket or any contact sports is there where helmet is allowed, so you should be wearing that helmet. So these are the preventive strategies. Now, once you face a child with a head injury, mm, suppose the child falls from the bed or he hit on the wall while walking or anything. So the parents gets very anxious, what to do, what not to do, whether to rush to the hospital right now or not. So I would like to give you certain tips. So once your child gets a head injury, you have to look for five things: whether the child becomes unconscious after the injury, whether there is a sign of convulsion, like there is uprolling of eyes, there is frothing from the mouth, and the hands and legs are becoming stiff. So these are signs of convulsion. So any unconsciousness, any convulsion. Then third thing is whether there is any projectile vomiting, repeated vomiting without any cause. There's the baby goes on vomiting and vomiting, and it is very like projectile vomiting. If this happens, then it is also a danger sign. So unconsciousness, convulsion, projectile vomiting, and last two are the bleeding, bleeding from nose or bleeding from ear. If these five things, any of these five things is there, then there is very high chance that the child has got any internal injury. So you have to rush to the hospital, emergency of the hospital, or you have to rush to your pediatrician at that moment of time, be it in the midnight or anytime. You have to go to the hospital and get your child evaluated by a doctor. If required, we have to do a CT scan to see whether there is any injury inside the head or not. But if these five things are absent, then you can reassess your child. You can go on monitoring your child for these five things for next 48 hours. You have to be very careful and looking for these signs. So first scenario, any of these five things are present, you have to go to the hospital right away. But if these things are not present and there is a swelling, the child is crying, there is pain, so you can tackle this pain, you can tackle the swelling with some paracetamol. Give the paracetamol as this with the same dose as of fever. This will take care of the swelling, this will take care of the pain. And if you find your child playful, going about to his activities normally, then you can wait for that time. You don't have to rush to the hospital right now. If it is the middle of the night, you can wait. We can, but you have to go on monitoring the signs, and you can reach to your pediatrician the next day. But in the meantime, there is an important thing that if these five things are not present, but you have to go on monitoring for next 48 hours, because these things can come anytime within 48 hours. And if you find this thing coming in like after 2 hours or like after 5 hours, after 24 hours, if you find any of these things coming, this the five danger signs, that is unconsciousness, convulsion, projectile vomiting, bleeding from eyes, bleeding from nose or ear. uh, at the beginning there was nothing, but after like 12 hours you see any of these signs, then you have to go to the hospital right away. But if 48 hours goes away and there is nothing, the child is absolutely normal, playing, doing every activities normally, then you may wait and just go to your pediatrician for a routine checkup, whether to do anything or not, whether just get in touch with him once. And for this pain and swelling, you can use paracetamol. Now, something I would like you to avoid, there is a habit of applying some thrombophob gel or any other gel on the swelling, and also applying ice and anything. So, applying gel does not help, but it is very close proximity to your eyes. So, the child may rub the gel inside the eye and it may damage the eye, it may cause irritation in the eye. So there is no need for applying any gel on the swelling or anything. You may use some water or ice for momentarily, but applying gel is I think not required. Giving some paracetamol is okay. And monitoring for these five things is the most important thing that you have to do. If you find any of these five things, you have to rush to the hospital. If there is nothing, you can wait for the being, you can give some paracetamol. If the child is sleeping, okay, then go, let your child come in contact with your pediatrician the next day. You have some time, no problem. And usually in 80% of cases there is no danger sign and there is no injury inside the brain. and nothing is required except for monitoring for this danger signs. So once you get these danger signs, perhaps by bad luck there is a bad injury and there you get any of these five signs and you have to rush to the hospital. There usually the medical person there in the emergency would, or the pediatrician there would examine the child, and it is advised to do a CT scan if there is any of these danger signs, because there is a high chance that there is an injury inside the brain and we have to look for that injury. And in CT scan, if there is any problem, we have to treat it accordingly. So my last summary would be: don't panic, just look for the signs. If the signs are absent, you may give some paracetamol, wait for some time, and get in touch with your pediatrician the next day. And there is no hurry to do a CT scan or like that. But if there is any danger sign, you have to rush to the hospital. Now, the baseline in my practice, babies are going to hurt their baby. The babies are going to hurt their head. They are going to fall. They are going to fall while walking, fall while running, fall while doing activities, fall from the bed, fall from there. So head injury in children is something very common, but the incidence of internal injury is very less. So do not panic. Follow the protocol that I have given you, and in maximum cases, it is just swelling, nothing else. And just go on looking for these five signs for 48 hours after the injury, and try to get in contact with your doctor in the next available slot. So thank you for watching. If you want some other videos, you can comment on the comment box, and you are free to join the video the YouTube channel that I have opened. Thank you.